What's up, everyone? This is Aaron English here from Advanced Movement, and today we're going to be going over a live fascial stretch therapy demo and why FST is great for pregnancy. What's up, everyone? So like I mentioned earlier, we're going to be talking about why FST is great for pregnancy and going through a live fascial stretch therapy demo while we do that. But before we get into that video, I want you to hit that subscribe button if you already haven't. Make sure you like the video if you like the content, and make sure you hit that notification bell up in the corner to make sure that you don't miss out on any awesome content we put out. So just a little bit of a background before we get into the video. The patient that I was treating, she was 32 weeks pregnant. She also actually had her pregnancy at 36 weeks. So a little bit earlier than anticipated, and she was having hip pain, some low back pain, a lot of pain around those hips. So let's get into that video in 3, 2, 1. So for the people that are new or don't know what FST is, or what you're asking yourself what FST or fascial stretch therapy is, fascial stretch therapy is a unique and complete table-based assisted stretching system. It focuses on fascia and joint capsules as a key holistic element in achieving mobility, strength, performance, and pain relief. So we have a great table-based system that I use with my patients. In regards to pregnancy, a couple things you want to take into account. First of all, you want to obviously stay in your scope of practice no matter what therapist you are. Maybe you're just a fascial stretch therapist, or maybe you have some training like a massage therapist or athletic therapist, physio, chiro. You might be able to do a little bit more, but for this strict reasons, I'm just utilizing the FST techniques that I've used, and I've stayed within my scope of practice. Another thing, pregnant women don't like being on their backs that often, so whatever you need to do on their back, either do it quickly at the beginning. Like in this video, I start with her on her back doing a little bit of lateral line stuff, and then switching quickly to side lying, making sure I get everything that I need to get in that side lying position. As the video goes on, you're going to see we're going to be working on her hip, we're going to be working on her quad, front part of her hip, low back, and then I'll work her way all the way up to the armpit and lat area and shoulder. So I did all of that on the one side, incorporating some of the percussion technique and massage therapy gun, like our hypervolt that we use, just to kind of help with down regulating the tissue, kind of help with just a little bit more relaxation into the treatment. And then going and switching over to the opposite side, do everything side lying. I do follow a little bit of a sequence, but you don't have to. I kind of feel it out a little bit as well from the beginning when we do kind of like an assessment, kind of seeing where everything is. We kind of see where the tension is, what is kind of what is the main complaint. Orthopedic testing, muscle testing, and then I kind of feel from there throughout the treatment session. And obviously constantly checking in to see if your patient's okay. So kind of went to the other side. We ended up working the opposite side as well. And then once I finished both sides, we switched to what I had to do with what was on the back, and which was kind of like a little bit of a glutes. We got a little bit of hamstrings in there, some quads a little bit, and then finishing off with her calves. And then I addressed a little bit of the neck, just to kind of put her more into a parasympathetic state, kind of that digest and relax type state, to kind of help with the overall treatment, to kind of help her feel a little bit better. Hey ladies and gentlemen, if you're liking the content that you're seeing right now, make sure you hit that subscribe button, bang that like button, and make sure you hit that notification bell to make sure that you're getting all the amazing content we're going to be posting on the channel. Another question for therapists and pregnant women. Therapists, have you ever worked with pregnant women? How late have you worked with them up in their pregnancy? Comment down below. And if you're a pregnant woman, have you ever had fascial stretch therapy or any other soft tissue manual therapy done during your pregnancy? If you have, comment down below and tell me what was your favorite part of that. Okay, now back to the video. Another thing that you want to do while you're in this dealing with pregnant women is that if you create all that mobility, because obviously pregnant women are their bodies are rapidly growing, so things are getting pulled and twisted and whatever because of that, the increased relaxin in their body's going to create a little bit of looseness. So make sure that you're going super light, super gentle throughout the entire session. And then once you've created all that new range of motion, you want to make sure that everything's stabilized properly and everything is getting kind of strong, obviously, to make sure that the body's growing in the way that it should, the body's opening in the way that it should. So any pre and postnatal exercises, super easy, simple stuff to do at home for her to kind of help with stabilizing the joints after you've created that new range of motion. No affiliation as of with these guys, but I would check out Girls Gone Strong. They got great pre and postnatal education for any sort of trainers, therapists, or anyone that's dealing with pregnant women. Great tools there. And you might be asking, like you've seen all the side-lying stuff. A lot of that has to do with a higher level of FST or fascial stretch therapy. So if you're looking to gain more knowledge and actually get the certification or learn these techniques, is basically you have to do your first level, which is your level 1 fascial stretch therapist, and then your level 2. If you're looking to get in one of those certifications, you can go to stretchtowin.com. I know right now there's not a lot of options of actually doing the course in person at all. Maybe in Arizona, but definitely not in Canada from where I'm from. But as soon as this the entire world gets better, they're going to be doing live in-person courses. So if you're looking at that again, make sure you check them out as well. So I hope you enjoyed the video. Again, if you liked everything that you saw, make sure you smash that like button. Hit the subscribe button if you're going to continue watching our videos, and if you want to know when the next one's coming up, make sure you hit that notification bell. We're going to continue to do some education, some live, possibly some live stuff with other people, some interviews, bringing other people onto the channel, and then obviously some tech and equipment or anything to do review with the industry. Yeah, so if you enjoyed today, make sure you come back next time, and until that time, make sure you stay mobile.